this is going to be a very descriptive paper. It's not going to have a model. If I have some time at the end, then I'll have an early kind of version of a paper that actually uses a model to do some calculations. And what I learned this morning is more optimistic view of fertility. Maybe if we use we wait a little longer, things may come back up. And then Jesus crushed all expectations, saying the world is going to end. I'm going to look at this from the point of view of public pensions. As I get older, I'm more interested in Social Security, and I'm now past my full retirement age. So I'm one of my agents in the model who may retire soon. So here's what the background. I don't need to say much, but countries are very different in the timing and extent of their aging processes. And as multiple speakers mentioned, Japan has been the first advanced economy to start aging, and they did age very rapidly. And they have been the poster child. Their old age dependency ratio that I'm going to take as the number of 65 and older divided by the 20 to 64, it's about 52% already. So it's a really old economy. India, on the other hand, is just over 10%. China is in between 23%. So they're very different in terms of how young, how old the populations are.
What do you mean in the US?
In the US, it's about 30%. So what I'm going to, and this started a very long literature. This could be, I think, Christina's first paper. So back then, 26 years ago, Christina Thaler and I did a paper where we calculated the transition path between an initial steady state and a far in the future final steady state that was driven by the SSA's projection of time variation in cohort life tables. And we said, okay, if you want to maintain the benefits unchanged in Social Security, what has to happen is an increase in something like 30 percentage point in the payroll tax, not the payroll tax, labor income tax. So obviously this is not going to happen. The point of the paper was something needs to be done as soon as possible. And by the way, back then, this is like late 1990s, the Social Security Administration was saying, if you just raise the payroll tax by maybe a couple percentage points, no more than 4, everything will be fine. And our models were saying much worse, partly because of labor supply and other responses in the model. Now, a lot of economists like Tony and Doug and Sagiri did this for Japan many years ago, and there was even worse for Japan. The additional taxation required was like 50%. The consumption tax would have to go up from 10% to 50% for a few decades. These are massive tax increases. Now, the recent and really severe declines in fertility make this a bit more pressing problem. So what I do in this paper is pick 2 simple metrics like old age dependency ratios or how many times one has to postpone retirement age to maintain dependency ratios unchanged between now and 2100. Those 2 simple metrics to see how bad the problem may be in a select number of countries. Obviously, one has to write down a model to evaluate these things like Adrian has done, and I'm doing it currently with co-authors. But in this presentation, it's just going to be some very simple metrics. So I picked some countries on a fairly ad hoc basis. I'm going to use wherever I can have access to local official statistics. That will be for the US and Japan. But I will use the United Nations, Jesus's favorite data set, to kind of take a look at the projected aging in US and Japan. There's obvious choices. UK is very similar to US in terms of demographics. I'm going to use that. I picked Denmark partly because they have, I think, in the law, the highest normal retirement age or full retirement age is 70. And in fact, they even have a provision where if demographics go worse, you can rise to 74, which is the only country I know of that has that high a full retirement age. Then I'm going to look at the major economies of EU, Europe, France, Germany, Italy, Spain. Then I'm going to also look at some newcomers. These are the Brazil, China, India, Korea, and Turkey. For some reason, the official name changed to the way we spell it in Turkish. So I'm going to look at 13 economies. And let me, obviously, Korea has the lowest current total fertility rate, and the others are kind of young, but they're getting old fast. All right, so what do I do? I'm going to calculate the old age dependency ratios, and from, let's say, 2024 through 2100. The second rule is some very ad hoc rule of raising the full retirement age by 1 every 5 years, just to see, and loading everything onto the retirement age to see what it takes to stabilize the old age dependency ratio at the current levels. Obviously, you need to model the generosity of the system and so on, but that requires a model that I'm trying to avoid in this presentation. And finally, what I do is I have a very simple back of the envelope calculation of the unfunded obligations of Social Security, and I apply to Japan also. Finally, I say, well, Japan did a 2004 reform of their public pensions. They introduced something called a macroeconomic slide. I'll explain it more later on. What if US were to do that between now and, let's say, over the next 25 years only? How much would that go in terms of reducing the unfunded liabilities of the Social Security? So that's all I do in this paper. All right, so what do I find? So I don't need to tell you, you know the demographics better than I do. The range of projections is extremely large in the old age dependency ratios. I'm going to demonstrate that to you. SSA is the most optimistic. They have the total fertility rate converge from 1.6 to 1.9 in a few years and keep it that way for the rest of the century.
Is that based on a mean reversion, the kind that Jesus was describing? I think it is.
Yeah.
Right?
SSA, they have their own models.
Right.
Yeah. So that's the others keep it at about,
that's the same.
about 1.6 or so. So the others, meaning CBO, Census Bureau, and also the WPP, they're about 1.6 forever. Japan seems to have contained the public pension issue. I'll make this point clearer later on. These younger economies, as China, India, Brazil, Turkey, and Korea, they are really facing a very, very bad prospect going forward. And China and Korea will get older than Japan fairly soon. And the smallest number of postponements of the full retirement age is Japan. All it takes is 6-7 years. The largest could be 23 years. So obviously these are not politically feasible, but it gives us an extent to which these younger economies are facing in terms of their fiscal pressures. All right, again, US, UK, Italy, Spain, they're all about 10, and the others, Germany, France, and so on, they're about 8 or so. Okay. So what do I find? I find a unfunded obligation of Social Security Administration. I'll tell you how I calculate this number. The official number in the 2024 trustees report is 23.7 trillion, but they have a very complicated way of getting the number. And then it has a fairly high range, depending on which official statistic you use or WPP. This can be as low as 16.8 or much higher, at almost $31 trillion. And using projections from the World Population Prospects or the census raises the lower end significantly. Whereas if you do the same calculation for Japan, the problem is already solved. They don't have a problem. It's a negative number, meaning they have assets at the end of 75 years. And the reason is that they have this macroeconomic slide that they've initiated 20 plus years ago. The law says benefits can be reduced, per person benefits can be reduced by almost 1% every year until 2047. And so the adjustment to the benefits will be less than wage increases, and it will be it's indexed to the size of the retiring population and expected rises in longevity. The problem is they have had deflation. So they really didn't utilize this macro slide for many years. It was fully utilized in 2015, and now that it's beginning to kick in as they have an inflation rate, I think, higher than that in the US. If you apply the same slide, and in the calculation, I use 0.8% per year reduction in benefits, per person benefits, the Social Security Administration's unfunded obligation are cut down to $10.2 trillion. Yes.
So unfunded obligations, you mean present value of
The present value of
maybe the payments I need to make relative to
taxes coming in
from the taxes
minus
that are
benefits
earmarked.
given out. I'm sorry, the benefits to be given out minus taxes minus the current value of the trust fund.
Right, that are earmarked for Social Security taxes, same in the US.
Yes,
Right.
yes. And I'll show you exactly how I do that calculation towards the end.
In many countries, pensions are indexed more to prices than wages, and actually, I mean, at least in France, that's like the entirety of how they think they can solve the problem is with productivity growth. Right?
That's, I mean, if you don't have productivity growth though, it doesn't really change much.
Because I actually brought something for the Spanish pension system, showing that productivity growth doesn't fix the problem, but I can tell you later.
Okay, yes.
Just out of curiosity, how do they manage to make both these bills? Because it's like the elderly Japanese voted.
How did they implement this?
Yeah.
The macroeconomic slide? I think it owes more to the political economy of how Japanese political decisions are made. The ministries are extremely powerful. The bureaucrats are super powerful, especially Ministry of Finance. They initiate a lot of talk and research and influence policymakers and convince the Diet to pass laws, unless there's a prime minister that has a lot of power, like Abe used to, and Abe would be in favor of this. This started in Koizumi era. So right now there is no coalition in Japan. Country runs just fine because the ministries are just doing their jobs. So I think it owes more to the cultural aspects of there's pain involved. The young workers have to do some by raising the payroll tax from 13.8% to 18.3% over time, which they did. But the elderly, the retirees also have to pay, get some pay. They're going to reduce their replacement rates over time. So it was a very interesting kind of coalition, and they managed to get this done in 2004 when demographic projections looked terrible. They still do, but not as bad as it.
So the slide is on the replacement rate directly.
The slide had three components. The slide is on per person benefits. They will not. So there's every year they are supposed to go up by average wage increases minus the slide factor.
I mean, in France, I mean, it goes up with CPI, which
Yeah.
we hope is 0.9. That's what in their basic calculations, it's all wages growing faster than prices.
Okay.
So it's actually similar. I mean, and
So
they think this is kind of what stabilizes the problem, because over time you lower the pensions relative to the wages.
But the point, because I actually did that calculation for Spain. The problem is because wages are growing, what you need to pay for that generation that is working now in 50 years will also need to go up. And because the internal rate of return of the system is above the growth of the economy, which is kind of what you will need to do, they need to be equal. They all result by Samuelson. For the system to be sustainable, actually in present discounted value, you are worse off the higher, the fastest the productivity growth.
Yeah.
So, if you think that
They're all indexed to.
no.
So let me show you. I think I'll start with Japan. In Japan, the main source of demographic data comes from the Ministry of Health, Labor and Welfare. There's an Institute for Population and Social Security Research. They had 6 waves so far, and the red is the first one, and then came a worse. This is the old age dependency ratio that I'm plotting. Then came the green one in 2002. Then it got worse. The most recent one, at least, wasn't as bad. So Japan is looking at an increase in their dependency ratio from about 52% to just about 80% by 2070. And then we assume it's going to stay there. We don't have data beyond that.
These
So
are updating this based on sort of fertility rate estimates or
every
longevity
5
estimates?
years, they update that, mostly on the fertility. There's not a whole lot of migration into Japan. There's some more recent years, but mostly on fertility. Yeah.
But I guess the really striking thing is that they, like, the black curve for 2020 is based on real data, and it's like less bad than they thought it was going to be, right? Right at the beginning of that curve.
Yeah, yeah.
That's actually.
Right
that's
here,
not a
exactly,
projection,
yeah, yeah.
And so,
Yeah.
less bad.
It was not, it just a
Amazing.
little, exactly, it wasn't as bad.
Yeah.
Correct. So this is when there was a lot of discussion in Japan as to what they should do back in 2002, 2006. That's when this slide was implemented because they looked at this and the old age dependence ratio back then they thought would go to 0.9. So they were panicked.
So when TFR in Japan stabilized around 2000 and kind of stay more or less at the same level until 2021, where it has started going down again.
Yeah.
And I think that in the initial projections, they thought it would continue going down.
Yes.
And that's why they look a little bit better.
But back to the last year, 2024, the realized number of births was even lower than the lowest projection. So now this is
So again, so
Yeah.
in 2021, it seems to have started.
Exactly,
going down.
So that's kind of the background to how they came up with the macroeconomic slide. So now I'm going to show you just the 2023, and they have kind of different flavors depending on their fertility assumptions and so on. So you have the medium one, and then this is kind of the worst case scenario if fertility is really low, and then this is kind of the best case from a kind of a public pension financing standpoint. So part of my research is to come up with a model that measures the difference between having a worst case scenario realized versus the medium case versus the best case. Yes.
So public pensions are a problem, like, when you go for those numbers, who's taking care of all the demented people?
In Japan, this is just pensions, obviously. Long-term care is one of the biggest issues, Andy, in Japan. It's publicly provided, 10%
Where's the
co-pay.
workforce gonna come from?
They're trying to get some nursing programs in East and Southeast Asia without much success. Part of the reason is they have to pass a language test, which has an extremely high fail rate. So they're kind of stuck. I don't know, robots maybe? They're working on robots.
Right, they have.
All right, so let me jump into WPP, Jesus's favorite. Look at the range in there. Like this says, I mean, the old age dependency ratio will hardly ever rise, obviously. And the difference between these is, I think, a difference of 50.5 in fertility rates, TFRs. As simple as that, where that number comes from, nobody knows. So part of the project will be to actually quantify how bad the tax rate has to go up to maintain benefits at current levels if this is what's being realized as opposed to that. But that is not the paper I'm going to show. So I put here some of the advanced economies, and Japan is the top one, old age dependency ratio, the black one. And there's Italy is kind of second. And obviously, we have Spain, a very close third. And then at the very bottom, you have the US. Now, again, this is using the WPP data to the extent that their fertility rates are too low or too high, then this can go every which way. But they're kind of enveloping these all advanced economies. And obviously, you see here the Denmark, Germany, and France are very similar. They end up at very similar points.
So why does the US differ so much from France? I mean, one thing about the fertility rates is they've actually tracked one another very closely. So is it longevity?
France, they live longer. It's gotta be, I'm guessing that's gotta be, and I think the difference is probably not insignificant.
Yeah.
One thing I should have done is maybe done some scenarios where I try to account for the movement of old age dependence ratio coming from assumptions on fertility versus longevity. I haven't done that. All right, now these are the late bloomers. Japan is still this black curve. And right now they're by far the oldest, but you have this, especially Korea is expected to overtake Japan in about 25 years. And China soon after. So that's what we are looking at for these all young countries. Here's the important point. Some of these economies are very young. This is India and so on. So they have a very small old age dependency ratio, but they're going to go up by 3 times or 4 times. That's a tremendous increase in their old age dependency ratio. So think about number of people paying taxes versus number of people receiving benefits. The imbalance is huge. Whereas for Japan, it's going to go up from 55%, let's say, to 80%. That's a much smaller increase in the numerator versus the denominator in that calculation. Okay, so just to give you some snapshots of the fertility rates assumed by WPP, they're kind of centered around 1.6, except for like China and Korea or Spain. Again, nobody knows if these will be higher or lower going in the near future. And a graphical representation of the table, they're sort of magically converging around some number far in the future. And again, in particular, we have the Korea rising much above. This is maybe 1.25, 1.3. So that's the assumption. So now for the US, we have 4 data sources. Every data source seems different. So CBO, Census Bureau, Social Security Administration, and UNWPP, they have their own population projections. And there's one outlier, that's the SSA. And they are the ones that are calculating the unfunded obligations. So I'm going to use all data to calculate my own unfunded obligations. All right, so let's move on to the Census Bureau. They have a lot of variants of their projections. I think we can rule out the high immigration for the near future, so that's probably not going to happen. So this is their medium variant, but there's a significant difference in their medium versus zero immigration variant. And this is from 55 to 7, almost 22, 23 percentage point difference in the old age dependency ratio. And again, the model we are building is a very big OG, typical overlapping generations model with a lot of bells and whistles to try to put a number on fiscally what this means, not only fiscally, but what will happen to output per person, and the welfare implications on young versus old, so on. But that's a different paper. Again, the range is gigantic. If you use the WPP for Japan, in the worst case scenario, the old age dependency ratio will be close to 1.2 in Japan. For the US, again, there's a huge range. And let me just show a simple table. This is the WPP data. This is essentially where we are or where we will be very soon at the end of this year. And this is 2050, 2075. And this just gives the low fertility, medium fertility, and high fertility values of the old age dependency ratios. Some of these numbers are difficult to digest. You have more than 2 retirees per worker in China, more than 1 in Brazil, Spain, Italy, Japan, and almost 2 in Korea. So these are probably very, very hard numbers. But if I'm going to also do calculations with these low fertility numbers just to see what the implications are from a macro standpoint. Okay, let me not show you a million other tables or graphs. Let's see if there's anything interesting here. These are UK and Italy. I should have the same vertical axis. I don't. Italy seems to have a much higher. Germany and France are very similar here in terms of where they will end up in all 3 cases. I did not know this. Again, Spain is closer to Italy than anybody else. Maybe I should have them in the same figure. Japan and Turkey, I don't know why I have them on the same one, but again, so this is kind of the old age retirement, old age defense ratio in Turkey now. It will be, I think it will like almost quadruple if the projections of WPP are correct. And we are talking about the medium variant. If I go with the less optimistic number, it's going to go by a factor of 6. And clearly, these things will have severe fiscal implications. Brazil and India look very similar in terms of the burden that they are looking in, fiscal burden they are looking at in 25, 30, 50 years down the road. And China and Korea are obviously at the complete high end of where these numbers will go. All right, so in this simple table, I looked at the current dependency ratios, old age dependency ratio. By the way, I did them for 15 to 64, 15 to 69, 20 to 69, you get very similar rankings. So these are the current old age dependency ratios. Then the second column here of numbers, they say when Japan was at the dependency ratio of these economies. So in 1970, Japan had the old age dependency ratio like India today, and so on. And the last column of numbers show when the other countries will reach today's old age dependency ratio value in Japan. And you can see, according to these numbers, Italy is going to be there in today's Japan. This is the Japanification, I think, of the old age dependency ratios in about 9 years. And US essentially, it will take a very long time. Korea is very close. Spain is very close. So these are some indicators of aging of these economies. All right. So going back to the work I did with Kristen and Tom decades ago. So this is something we calculated back then when the retirement age was at 65, but it was kind of, it was in law ready to be phased up to 67. And the question we asked was, oh, how many times do we have to postpone the full retirement age in the US, given the demographic projections by SSA, to maintain the old age dependency ratio at the 1975 value? And we said it's going to take 11 postponements. Clearly, this is not feasible. 11 postponements over 65 would mean 676. Okay, so Lee and I couldn't retire yet, or Gary. So that's, I said, let me revisit that with new data and see what we get. And I did, okay, let me use the census data first, and then WPP. So this is one area where the two data sets gave me the same answer. So I was kind of surprised with this, but well, not the same, but almost the same. Using the census data, you need to postpone the retirement age in the US from 67 to about 75 and a half. And if you use the WPP, you have to postpone it maybe one more year. But it was kind of broadly consistent with what we found earlier for the US. And for US, the two data sets gave very similar results. So then I looked at the implications of low and zero immigration, didn't look at high immigration for the US. Using the WPP, it does raise the old age dependency ratio, number of postponements by maybe a year here, maybe 2-3 years here. So that's kind of so if you believe zero immigration, then this fiscal problem in the US is more severe than medium immigration. Yes.
So when you're doing this calculation, you're assuming like kind of full compliance. So like you change
Yes,
the
this is the
retirement age.
This is
and then
the
you're just looking at the dependency ratio with that as a.
This is I'm doing something super simple and mechanical. I'm literally moving the
The numerator and the denominator.
Exactly, that's all I'm doing. Exactly, adding 1 year
Because in practice, I mean, as you push it out.
Of course. This is like
Like there's all this behavioral.
not even back of the envelope. This is on a napkin. But I think one really needs to do a full grown OG model to see how people will behave.
And also it depends on healthy aging or something.
It depends on that. It depends on any change in the parameters of the retirement system, generosity and other taxes. Yeah.
Just say low versus medium immigration. Can you say what you mean by that? Is low like what we have now would now be?
No,
or how many-
not the current one. I think the 2023 level of immigration is considered medium, but those are all estimates. And I don't have a number at the top of my head what that number is. I have that number, but
No, just to give a
Yeah.
sense of what we're talking
all
about.
right. Okay, so and then I did this for Japan. Again, I used the official Japanese government statistics and also the WPP. I get literally the same number in this case. I was really surprised that they would kind of match. So in Japan, given that they are already so old, it takes about 6.5 years of postponements to stabilize the old age retirement ratio at the current levels.
That's like a statement that population distribution is closer to stationary.
Exactly. The guys are already there, almost not there, but yeah, they're exactly. And India and Brazil, China, Korea, they're not there at all. So I said, okay, let me go to Denmark. In Denmark, you got to postpone it to maybe 75.5. To get back to here, you need something closer to maybe here, somewhere here. So Denmark needs a bit more work to do if they want to do it this way. Of course, they can change the generosity and raise taxes, whatever. They can do other things to influence all the decisions. Germany, this is Germany and France. They're very similar. They're similar in one sense. Okay, look what I did for France. I started from 65. So if I were to pull back this to 62, which is kind of the current one, then you would need more postponements. For whatever reason, I start from 65. At least for Germany, I start from 67. You're going to go up to 75. Italy and Spain, you have they're very similar in terms of the demographics, I think. So they both have to postpone to age 78 to stabilize the. So there's a lot of work for you, Jesus. Don't stop. For UK and US, they're very similar. You've got to go to about 76, 77. So India, you have to go to 79 from 60, current retirement age 60. And it's not 60. There's a lot of early retirement depending on profession and gender and so. So I started at the highest end of 60, and that requires an enormous amount of postponements. Obviously, this is never going to happen. For Brazil and Turkey, you got to go up to 83 or 84 years old. So these are kind of disastrous numbers here. For China and Korea, even older.
But what is their life expectancy that they assume? Because if retirement is at 84.
No, they'll be on life support, but still working. They'll do, I don't know, brains are tied to AI or something.
Because if the life expectancy is 86, 87.
Oh, yeah, I know.
So sorry, I am only paying you for 2 years.
That's true. So this is just a simple metric that I can use to compare across countries. Yeah. So just to emphasize how ridiculous it would be to try to postpone. So this is kind of the last of this calculation, which essentially something has to give. That's all, the whole point. So let me show you the scatter diagram with the current dependence ratio measured along the vertical axis and the number of postponements needed along the horizontal axis. And as you can see, these are the 5 countries that I think will face very significant fiscal pressure going forward. Japan is kind of facing the least fiscal pressure for many reasons. And everybody else is in the middle. Okay. So then I said, let me calculate unfunded. I have 2 people that I communicate with at SSA. One is very good at directing me to how to get the cohort life tables, super helpful. The other one is in charge of doing these calculations for SSA. And that person, I said, can you give me like a simple data code that I can use, like back of the envelope? He said, essentially, no. He sent me a 210-page document that describes in gory detail how they do the calculation. But I got the picture. So here's what they do. They first calculate the cost in year T to the SSA. So I'm going to take this as exclusive of administrative expenses. I will also, so this is kind of the benefits that they pay out. Okay. And then you have the income coming into SSA, and I'm going to ignore the non-interest interest income. I'm going to exclude taxation of benefits. And so you get costs and incomes, and then you kind of calculate the present value of each at using some discount rate, and then you add them up, and subtract the current trust fund. So that's how they get this unfunded obligations. Again, it requires use of administrative data. It's way beyond my ability to.
Just to understand.
Yeah.
2 points. Point number one, everything's in real terms.
Everything is in real terms. No, hold on, no. Everything is in nominal terms. There are lots of assumptions on inflation rates between now and 2100, and there's all kinds of assumptions on the rates at which wages will grow, the productivity will. So I'm considering all of this as real to be as simple as possible. Okay. In fact, in the next slide, I'm going to tell you exactly how I do it. So I take the net payroll tax contributions from 2023. This is the number. This is only for old age and survivors insurance. I ignore disability insurance. So that's the number I pick up from the trust fund or 2024. And I look at SSA's estimate of the number of people between the ages of 20 and 64. Obviously, there are younger people paying taxes, older people like us paying taxes, and so on. Ignore all of that. So I divide this number by this number. I get a per person tax of $53.24 in 2023. I'm going to assume this number is not going to change in real terms going forward, which is the same as essentially assuming that this number will change at the same rate as per person benefit for the calculation of the unfunded obligations. So then I get the total benefits dished out as old age and survivors insurance, ignoring disability, this number, and I divide it by SSA's estimate of 2023 elderly, that's 65 and older. I get a per person benefit of this number. So I'm going to assume that these numbers in real terms will not change. What I do is, going from 2024 to 2100, I'm going to multiply these numbers with various estimates of populations in these age groups, using SSA's number, using WPP, so on. Let's see what I get. Okay, and then I'm going to do all this kind of discounting. I'm going to use 2%, and I'm going to use the actual value of this trust fund in 2023, which was like $2.6 trillion, and calculate this number. Okay. So here is.
So it's not really about the discounting. It's just about C versus I, and they're.
Discounting does make a difference because I'm using future population projections.
Right.
And they can be bigger, smaller. So if I use
You're
it.
saying today, and then you're doing this calculation for each year going forward.
I'm calculating this cost, total cost. So I'm going to multiply. I'm going to multiply this number with the number of people in this age group, which I think are older, for each year.
Similar to the calculation I was doing.
Yeah, and then I'm going to calculate
For each
the
year,
value of
We're
those.
shifting the number of people in each year.
Yeah.
That are contributing versus.
Exactly. That's all I'm doing. I'm holding the per person stuff constant. Okay. And here's what I get. Using SSA's projection, I get this number. In the 2024 trustees report, they report $23.7 trillion. So I consider that victory for using my Minnesota metric. Close enough. I use different projections and I get bigger. Remember, SSA has the most optimistic fertility rate assumption. It's all coming from that. So I said, okay, this looks in the ballpark. Why don't I use this using all kinds of low cost, high cost, using SSA's terminology, or high fertility, low fertility. So let me get a different views. So this is kind of the baseline calculation. It's almost 84% of GDP in 2023. And the range is quite large. It goes from 111% to about 61%. But the key point here is if you use the low end, the low fertility assumptions, or zero immigration assumptions by Census Bureau or the UNWPP, then the bad end is much larger than this one. So it's close to or about 100% of GDP in terms of unfunded obligations. So there's a lot to kind of a lot of resources that the economy, the government has come up with to try to make this kind of fundable. So I said, why don't
How
I?
much does it matter? You're not counting the taxation of the social security benefit.
No, I'm not. I ignored.
That could be.
I could add
quite a
that.
bit, no?
Yeah, I would make this a bit less.
Yeah.
Abstracted from the interest earnings from the
Social
trust fund, which is
security.
very small, but
Right.
taxation of benefits
But
maybe
that's- Cause that's
10%.
like, I mean, you could say it's, yeah.
I know, I
But
should,
it's like, it goes back to the government budget, so.
no, I should take a look at that and see what it does. Okay, so I have 6 minutes. So let me give you a view of the Japanese pension system. There's one fixed part that everybody gets. It's like a lump sum part that's and half of that is paid by the government by this. A very interesting system. The second part depends on your average wage, and then there's a replacement rate that multiplies. It's a fairly simple system, simpler than ours, I think. But again, the macroeconomic slide was initiated in 2004. Payroll tax was raised and is done now. It's now 18.3%. What I do in this calculation is to kind of represent this. I'm going to assume that the slide leads to a 0.8% annual decline in per person benefits between now and up to 2050. I have another number that shows what if they extended the slide all the way to 2100. So let me move on to that table. Again, I do something very similar with Japan that I did with the US. I calculate their per person pension benefits received using the IPSS numbers. And that's the number I get. This should be a comma, 2 million. And this is the, so I do these calculations. This is kind of the payroll taxes, and this is the benefits they get. Again, this should be a comma that messed out. And what do I get for Japan? It is negative 14.1%. So that's why there's no panic in Japan about public pensions. There is some panic about health expenditures, especially on the long-term care side, because the co-pays are very low. And that's kind of biggest 800-pound gorilla now, but not the public pensions. So I do a lot of counterfactuals. What if they did no slide at all? And then they would be almost like the US situation right now, 99.4% of GDP as the unfunded obligations. But they've kind of fairly successfully managed to raise taxes and reduce benefits. And I assume the continuation of the reduction in benefits until 2050. If they extend this to 2100, then they'll acquire a much larger public pension fund at the end of 2100. All right, so what if the US did this slide? This number would go down to $11.2 trillion. If you extend it to throughout the century, then it goes down more. And this ignores the increase in the payroll tax. So I think one way this may be solved is by reducing benefits, especially on the wealthy individuals.
So sorry, so what's the magnitude, you know, of like the long-term care? Because I'm just trying to wonder, like, what should governments be more concerned about? Is it actually the pension?
Long-term, for Japan, long-term care. By far, the public pension problem is no problem. Then the replacement rates are falling. But the long-term care, they are not thinking of raising the copay. That's 10%. Public health expenditure copay is 30% until you hit age 70, then it becomes 20%. You get to age 75, drops down to 10%. So they're thinking now of making long-term care kind of like that, raise the copays. They're looking at a big problem there. But another problem is who's going to look after this Andy was saying, those people. And that's a big question mark. All right. So let me just make a quick, so I think the paper makes it, the economies that started to age earlier like Japan are in a better position to deal with this problem going forward. And number two, one way to deal with this going forward is to reduce the benefits in an announced fashion slowly. And Japan was able to do this without any problems, any backlash. And this is politically, I think, not feasible in the rest of the world. So
It is because of this indexation thing. I mean, countries differ a lot in how they index pensions.
Yeah.
But they usually slide it to the back door by indexing to, below wage rate, below wage growth, which is kind of effectively what they did.
that's
More
what
explicitly.
exactly, yeah, they're doing exactly that. Now, obviously, we need a kind of model to really measure these properly. And I have like 2 minutes. I'm going to show you, I think maybe one slide. I'm going to flow through a bunch of slides that have a lot of equations. So this is a project that I have with Tomoaki Yamada from Meiji University. So we built a general equilibrium overlapping generations model that's going to be it has a warm glow, bequest motive, factor price and endogenous, and we start from like pre-1980 as its initial steady state. Final steady state is way in the future and calculate the equilibrium transition path. So what I'm going to show you is what does the consumption tax rate, which is currently 10%, have to be to deal with the aging in Japan, given the median projections. So what I'm going to show you, okay, I'm not going to show you
Does
these.
this account for this long-term care stuff or not?
This one does.
Okay.
So the one thing I cannot answer is how much of this is coming from long-term care and public health side as opposed to pensions. Most of it is, but I don't have the accounting done yet. We just did it yesterday. So let me just point to two numbers. Current consumption tax rate, 10%. This has to go up to 42.9% forever. That's obviously not going to happen. And this it still says there's a severe public health funding issue in Japan. Now, this is using the last wave. If I were to use wave number 4, which is kind of more pessimistic, this rate would have been almost 10 percentage points higher. So it makes a big difference which wave kind of you use, which fertility rates are realized in terms of quantifying the fiscal magnitude of the problem. Again, hopefully, maybe next year or in a few months, we'll have a complete picture of this issue. Thank you.